Good afternoon. My name is Adrian Dix. I'm BC's Minister of Health. To my right is Dr. Bonnie Henry, BC's Provincial Health Officer. I'm honored to be here today on the territory of the Lekwungen-speaking people of the Songhees and the Esquimalt First Nations. As all of you know, BC's vaccination campaign is going very well. One of the most impressive levels of vaccination in all of the world. 82.3% of those eligible, those over 12 as of today, have received their first dose of a COVID-19 vaccine, and 71.6% are fully vaccinated. The numbers of those partially vaccinated, of course, is declining significantly day unto day, and the gap between first dose and second dose, those numbers, is declining significantly and will continue to decline significantly throughout the month of August. The priority that we've given and we give to long-term care and assisted living residences during this pandemic is significant and certainly has been our top priority in terms of vaccination. We started vaccination in long-term care. It was the highest priority of all places in British Columbia in December of 2020 and have continued that effort of vaccination throughout our long-term care and assisted living homes since then. And the impact was immediate and dramatic. We went in a few short weeks from 49 care home outbreaks on January the 15th in British Columbia to almost none in the month of February, which shows the impact and the value of vaccination for those living in long-term care and for those working and helping people in long-term care. I want to recognize the exceptional work done in all our long-term care and assisted living homes by care staff, those who keep facilities clean, those who provide food, our nurses, people, doctors who work and support people in long-term care, health sciences professionals, pharmacists and others who do all of the work to support residents in long-term care. All those who work, especially in these difficult times when visitation has been limited in long-term care, to provide social and other supports for long-term care residents. People in British Columbia are grateful, and I am grateful for all the work that has been done. In terms of those working in long-term care in particular, we've given priority to those vaccinations, and you've seen those numbers across BC, more than 40,000 people working in long-term care. A very significant number as well in assisted living have been vaccinated since the beginning of the pandemic. A number of weeks ago, we announced new measures to ensure protection for those living in long-term care. Those measures included work on an order to ensure that we knew the vaccination status, public health knew the vaccination status of everyone working in long-term care by care home and by individual. And secondly, the intention to ensure that everyone who is not vaccinated be tested, that everyone who is not vaccinated have requirements for PPE that were more than those who were vaccinated. Of course, in this period, in this time, we're seeing additional cases of COVID-19 across BC, more than 500 yesterday, and cases in all regions of province. We've also seen some increase in the number of outbreaks. Those outbreaks are not qualitatively the same as they were in the months of January and February and December and November of last year. Nonetheless, they are disruptive. People in long-term care, living in long-term care in particular, are vulnerable and especially vulnerable to COVID-19, as you know. And the fact of an outbreak, I can tell you as Minister of Health, but also as a family member, is incredibly disruptive and painful to residents in long-term care, to their families and everyone else. It means limits on visitations and limits on life after a year of limits on visitations and on life and on the fulfillment of life in long-term care. So today, Dr. Henry will be announcing some new orders to ensure the following: that everybody who works in long-term care and assisted living be vaccinated. This is a necessary step to take to protect residents and to protect staff in long-term care. We know, with variants of concern, that there is continuing risk for people living in long-term care, even vaccinated, and the risk of disruption continues to be high. And we think that this additional step to the significant steps we took earlier on, and we have announced our intention to take earlier on, that this additional step will add to the safety and the protection of all those working in long-term care. I want to thank everyone working in long-term care, and now I'm going to introduce Dr. Henry to go through the details of the provincial health orders. Dr. Henry.
Thank you very much, and good afternoon. We are here today, as mentioned, to announce important new public health measures for long-term care and seniors assisted living here in BC. As we have across the province, we've made excellent progress in our vaccination effort, and as mentioned, over 72% of people now are fully immunized. Particularly, this is important for people who are in those most vulnerable areas in long-term care and assisted living. And we, however, continue to see transmission, particularly amongst unvaccinated people and pockets where immunization rates are lower. This transmission is of particular concern in seniors and elders living settings. The risk is changing. As we have started to see an increase in much needed activities in our life, we have more people being able to come together, to go to work, to do all of those things that we've been missing in the last few months. And as well, we have the introduction of new variants into the province, including the Delta variant. And we've seen the impact of that in long-term care, where we now have 8 outbreaks introduced by unvaccinated people. And once we have recognized that once it gets into these highly risky settings, it can spread even to those who are immunized. And we've seen spread both to residents and staff, causing illness, but also disruption in the life of people in long-term care. Early in the pandemic, we recognized our seniors and elders living in long-term care and seniors assisted living were particularly vulnerable to severe illness and death from COVID-19. That's the setting where we have seen the majority of deaths, and severe restrictions needed to deal with outbreaks have affected their quality of life for far too long. That's why we took immediate actions last year to restrict movement of staff between long-term care and assisted living and assure access to PPE, and why we prioritized as the first part of our immunization program staff and workers and residents of long-term care. Today, we need to take an additional step to reduce transmission. And we are announcing mandatory vaccination as a condition of employment for all workers in long-term care and seniors assisted living. This will apply to all licensed facilities, whether they are private, health authority owned and operated, or contracted facilities. The requirement will be made through a provincial health officer order that will have a number of things in place. Primarily, the new order will ensure that information on all workers in long-term care is provided to public health so that we can verify immunization status and have an understanding of the immunization status by facility of both residents and staff. That helps us in assessing risk and assessing outbreak potential in those facilities. In addition, we will have the implementation in the interim of the requirement for unvaccinated staff to wear masks and additional PPE, as well as be tested regularly. We will then be working with the individual staff, individual facilities to make sure that every person has access to vaccination and has their questions answered. And everybody, all workers in all facilities will need to be fully vaccinated by October 12th of this year. I recognize that this is a change from the direction that we announced earlier in the spring, in June, where we thought it would be sufficient to have additional measures such as testing in place. We have now seen with the transmission of the new variants that we need extra protection in this highly risky situation. Even when resident immunization is high, as it is across the board in facilities in this province, we have seen transmission from unvaccinated staff, and it has reinforced the need for protection from all people in long-term care. So it is a change, but it is based on the situation that we find ourselves in now and how we need to deal with the data that we receive and take the necessary measures to make sure that we can get through this new transitional phase that we are in through the fall, when we also expect to see increased risks with other respiratory illnesses. This new order will also apply, the new PHO order will apply to volunteers and personal service workers who go into long-term care facilities. And it will apply immediately. We'll no longer allow anybody who's non-vaccinated, who's not fully vaccinated, to be a volunteer or to be a personal service provider in the long-term care assisted living facilities. We understand there are reasons why a small percentage of people may be unable to be vaccinated for medical reasons, and in those rare exceptions, public health will be working with those individuals, with the employers, and we will also be working through the next little while with unions and with owners and operators and public health to ensure that we have all of the provisions in place for people to make sure that we can get as high immunization rates as possible and support people through this process. I do also want to take a moment to thank each and every resident, care worker, nurse, healthcare practitioner, the people who provide the food services, the cleaners and workers in long-term care. We know this has been the most challenging time for all of you, and I know everybody has stepped up to do their part. And to the families who have entrusted these facilities to care for your loved ones, we know how challenging this has been for you as well. This is one additional measure which will ensure that we have the best protections possible to prevent outbreaks, to prevent the introduction of this virus into long-term care facilities and assisted living, and to make sure that we can return to the quality of life that our seniors and elders deserve. I will also take a moment to say that the reporting requirements that are part of this order will apply to healthcare workers outside of long-term care and assisted living, so in acute care and community care. And we will be working with health authorities, with unions, and determining our path forward for all healthcare workers in British Columbia in the coming weeks. So I just want to say thank you, and we're happy to take your questions.
Thank you, Dr. Henry. As a reminder to everybody on the phone line, please press *1 to enter the queue. You're limited to one question and one follow-up. First question today is from Penny Daplos, CTV.
Oh, hi there. Thanks very much for coming to me. Dr. Henry, jumping off from your comment there that you're going to be determining the path forward for all healthcare workers in the coming weeks, I had been planning to ask you what the vaccination rates are at Kelowna General Hospital, because the other day you said that surgical postponements were due to staff being impacted by COVID. But I've heard from several healthcare workers there in the meantime who tell me they've actually been short-staffed for months. It has nothing to do with COVID, and particularly when it comes to nurses, they're just really short-staffed. So are COVID infections and staff really impacting hospitals, or is it a matter of staffing issues that are having an impact right now?
It is all of the above. As we know, there's been a number of different issues in the interior in particular that have been affected by this. And yes, there have been staff impacts from COVID infections and from people who have been exposed, but there have been also staff shortages, as you know, for some time. And I know Minister Dix knows more about that.
I think it's fair to say that it's a challenging time in our healthcare system as well, though. I would say that we've, at Kelowna General Hospital, at Vernon Jubilee Hospital, Royal Inland Hospital, we've been doing more surgeries than we've done before, and we report on that regularly, and that reflects the extraordinary work of people there. So there are challenging staffing challenges in our healthcare system that are connected to, I think, in the last couple of months, especially extraordinary demand, ongoing challenges in staffing the system. And that's why we've made such, I think, exceptional investments by the standard of any province in our healthcare system. But nonetheless, those are challenges that exist. But when you have circumstances such as people off sick in terms of COVID-19, that has an impact as well. So all of those things are involved. There have been the cancellation of a small number of surgeries, I think 50 coming over the coming weeks. of the coming week in terms of cancellations of surgeries at Kelowna General Hospital, and that reflects the adjustments that we make all the time based on the circumstances we see. In the terms of we are moving resources and moving staff, for example, into emergency rooms this week, as we announced yesterday, to support people in the heat wave, to support people related to smoke, and to deal with COVID-19. So there are challenges at Kelowna General, there are challenges in other healthcare facilities in the province for healthcare professionals and healthcare workers, and we're working through those, and COVID-19 simply adds to that.
Penny, do you have a follow-up?
I do, and I'm glad, Minister, that you brought up the surgical renewal, but I will leave this open to Dr. Henry if she wants to respond as well. You know, it's anecdotal evidence at this point, but all signs point to a lot of nurses leaving the profession in significant numbers, in part because of burnout from the pandemic, but I'm also hearing again and again that unrealistic expectations for the surgical renewal are really, you know, grinding people down, and a lot of nurses are generally feeling devalued, and this has really shattered morale for a lot of those who remain. So I want to know what you plan to do about this dual crisis of morale and staffing in healthcare.
I think this has been an extraordinary year in healthcare, and the surgical renewal plan, which has added resources and added nurses and added anesthesiologists and added those helping to book surgeries, has had a profound and positive effect. There's also and a positive effect across the system. The changes that have been made under the surgical renewal plan to address the fact that in March and in April and in May of 2020 we canceled non-urgent elective surgeries. We did indeed cancel some surgeries also in this in the past third wave of COVID-19. We addressed that by responding as you'd expect the health system to respond, and I think we've done an exceptional job in doing that. And that job wasn't done by me; it was done by surgeons and nurses and healthcare workers and health sciences professionals across the system. It is of course a challenge to meet the surgical demands of a society that's both growing and the increasing demands of a society that to a degree is aging. But I think we've done an exceptional job. Look, before COVID-19, we went, in terms of hip and knee replacements, from 14,250 in 2016-17 to almost 19,000 in a short period of time. And that meant significant demands on the system, which we met with more resources in the system, but it also meant thousands of people getting their surgery sooner than they had done before. Similarly with MRIs, similarly with other types of surgeries. So the surgical renewal plan has been exceptional, and it's been delivered in an exceptional way by doctors and nurses and health sciences professionals. And of course, everyone working in the system in a pandemic, in the public health emergency that is the overdose crisis. And in this time and in the challenge for public health care in BC, this is a really difficult time for everybody, and we're doing everything we can to support people while delivering the services, especially the surgical services, that people in BC expect and deserve.
You know, thank you for bringing this up, Penny. I can't speak to the surgical services particularly, but I know from my personal experience in pandemics and in crises that we've seen, particularly ones that go on this long, it is not surprising to see people being burnt out. We all want this to be over. We all wanted this to be over last summer. And, you know, we have to deal with the reality that we are dealt with. And nurses have been on the front lines of this from the beginning. They've had to access PPE. They've had to change the way that we interact with patients, whether it's in a community setting, whether it's in a hospital. The pressure that we have had as healthcare workers through this pandemic has been over and above the pressures of trying to maintain families and relationships and all of the other things that we as a community are dealing with. So it does not surprise me that people are burning out, that they're leaving their profession. I see that from physicians. I see that from my ICU colleagues who are having challenges trying to find that balance again in our lives. I see it from public health physicians. I see it from all across the health sector. And we've also done the surveys, as you know, that help us understand the issues that we're dealing with in our communities and families across the country or across the province as well. So these are very challenging times. These are the things that we see after this type of an event that has happened and when it's gone on so long. So we do need to do what we can to support nurses, to support all of the healthcare workers in our settings across the province. And one of the really important ones was providing access as soon as we possibly could to healthcare workers to immunization so that we can support them taking that burden of fear and risk of COVID off as much as we possibly can. So we do need to support each other through this. It's unfortunate, I wanted it to be over too. I didn't want us to be in this position right now, but we are, and we need to keep going together. And part of that is making sure that we support each other to get immunized as quickly as possible, and especially as we go into the fall.
Burnaby Beacon.
For taking my question. Most prominent universities in Ontario have now made vaccinations mandatory. Are you recommending that universities here take their own steps in that regard if they see fit? Or do you think that they should be staying within the provincial guidance that you said last week that you're working to refine?
So I wouldn't say most universities in Ontario, at least not from what I've heard. However, we, as I mentioned yesterday and last week, these are questions that we are addressing with our provincial committee, working together with the post-secondary institutions in the province. They're very important questions. We have always had a collaborative approach. We have the basic guidance that we put out, and we are refining it as we learn more going through this last few months. These are active discussions right now. What is the role of masking? What is the role of immunization? And we'll have more to say about that next week.
Do you have a follow-up, Srishti?
Yes, please. The original guidance from July 5th for post-secondary schools predicted that cases would be declining by September. Was that projection premature? Did it not take into account the possibilities of variants?
Of course, it took into account everything that we knew at that time. We say that we're going to be continuously monitoring, changing, adapting as we learn more about this virus. And that's really what we are doing. That's one of the reasons why we've put in these measures today, which are also a change from what we thought would be the approach earlier on in June. So, these are, as I said, part of the constant connections and discussions, looking at the data, looking at the pros and cons of different approaches, and understanding the real situation that we're in right now. But I will say we are in a different place, and that is clear, and it remains clear. That we are no longer seeing the same types of impacts across society that we were seeing prior to having vaccination. So it is not the same questions that we're asking or answering right now. Immunization rates are high. We're seeing transmission in unvaccinated people primarily, overwhelmingly. 96% or 93% of our cases are people who are not fully immunized. So that's the difference that we're in right now. And yes, when we have a highly transmissible variant, it means that it can move quickly through unvaccinated or undervaccinated people. So the way we address that is not the same as where we were just a few months ago.
Next question is from Marcella Bernardo, News 1130.
Hi, Dr. Henry and Minister Dix. Wanted to ask you about this healthcare worker announcement. Are you expecting any legal action challenging these directives?
You know what? There's a couple of things that we've talked about. That's obviously we've got a legal advice around this as well. I had a conversation with the privacy commissioner about requiring of this type of information, and he is very supportive as this being a proportional and reasonable response to what we know is an ongoing risky situation. We know that particularly in long-term care in a senior assisted living, those are the settings where those who are most impacted by this virus are living, and even though they have very high rates of immunization, we need to provide them with the best protection possible so that they can have the quality of life that we expect for our seniors and elders. And do you want to add to that?
Obviously, legal action will be taken by other people, so it's we think we're obviously on a strong footing here. But there is going to be a lot of work done over the next period with healthcare unions and with healthcare employers across the system to make this effective and to make this work. And we're going to be also making every effort, of course, to continue to give people the opportunity to get vaccinated, increase vaccination levels. So there's a lot of work to get together. We've announced our intention and the date, which is October 12th, and we're going to do a lot of work together in the coming days and weeks to implement and to put in place these measures. And we'll be working with our healthcare partners to do that.
Follow-up, Marcella?
Yes. What problems, if either of you could elaborate, I think Dr. Henry would be best to answer this, but what problems have you encountered with certain care home operators? I'm hearing about some private ones, especially in the Kelowna area, not granting access to visitors now that those restrictions have been lifted. And will visitors be allowed to visit their loved ones if they're not vaccinated?
Well, and Dr. Henry will talk about the requirements with respect to visitors, but very clearly, and I'll say this to everybody, given what we've gone through together in this pandemic, and those people who are visiting by definition people they know, and in most cases people they love in long-term care. I think it's our expectation that people will be vaccinated, and if they're not vaccinated, there are of course a requirement to say whether they've been vaccinated or not. And if they're not vaccinated, there'll be measures taken because there'll be periodic visitors to the facility to ensure that people are protected. But my message to everybody, whether they're visitors or volunteers or anyone else, is that now is the time, and the opportunity exists. Now is the time to get vaccinated, because I can tell you, as someone who visits in long-term care, that what is tremendously affected when we declare an outbreak in long-term care, and there are outbreaks in long-term care right now in the Interior Health Authority, is the ability for people to go in and support their loved ones and be with their loved ones, to take advantage of the changes that have been made in visitation to make that possible. So we want everybody to get vaccinated, and that is particularly for people in long-term care. I'll just say finally that, as you know, we're working very hard in our capital plan to eliminate as much as possible multi-bed rooms in long-term care. But when you're visiting, even though you're visiting and you are required to go to the person in question, nonetheless, I think it is not just the responsible thing to do, the human thing to do, given these circumstances, to get vaccinated, whether you're a visitor or anyone else going into long-term care. And that's good.
Next question is from Colton Davies, Radio NL.
Thanks for doing this. If I heard right off the top, Minister Dix, you mentioned the vast majority, I think you said, of long-term care and assisted living staff are already vaccinated. So just curious if you can elaborate what percentage of staff are not vaccinated. And I believe you just answered it with Marcella's question, but visitors to care homes who are not vaccinated, they'll still be allowed, but we'll have to wear masks and other safety measures, I presume?
Yes to the second. Very significant majority of people are vaccinated, of course, high number of residents. And what the requirement for information will give us the comprehensive view of where staff are at and what we need to do. But I think here's what I would say in general about vaccination. Let's give you an example. In the community I live in, Renfrew-Collingwood, vaccination rates over 12 are 91.2% in the general population, which is high and is impressive, and very grateful to our neighbors and to everyone involved for seeing that happen. Over the whole province, over 12, it's about 82.3%. Not about, it's 82.3% today, which is a very significant level of immunization compared to everywhere else. Above 50, there isn't much regional variation, people who are aged above 50, between health authorities. So the level of people over, let's just use seniors, so we'll say over 65, vaccinated in Interior Health is not very different than those vaccinated in Vancouver Coastal Health, where I live, or Fraser Health, or Vancouver Island Health. The difference, the significant differences, are under 50 by health authority. In different health authorities, there are significant regional differences for people under 50, and we've got to address that. And that's been part of our Vax for BC effort, and we're making some progress in many communities, notably Kelowna right now. In terms of Kamloops, where you're from, Colton, it's about 80%, which is very good compared to just about anywhere in the world. But there's something that's better than 80%, and that's 81. And there's something better than 81, and that's 82. So we got to continue to grind it out and work hard to see that happen. So there'll be comprehensive reporting on these questions. But we have exceeded our initial goal of healthcare workers being vaccinated. But given the circumstances, we need, I believe, that level in long-term care and assisted living to be 100%. And that's obviously what Dr. Henry believes, because that's why she brought in this order today.
Do you have a follow-up, Colton?
Yes, please. Thanks for that answer too, Minister. So with this being announced today, coming in October 12th, does this open the door for potentially mandating masks in other workplaces where there could potentially be people at risk, such as hospitals, for example? Obviously, businesses can require, not admitting, I suppose, people who are not vaccinated if they choose, but could this also open the door for a mandate for certain businesses that might be considered essential as well, like grocery stores?
I'll ask Dr. Henry to answer that question as well. Obviously, she's already noted that the work we're doing in education and post-secondary education is ongoing, and you'll be hearing more about that soon. Today, what's being required in long-term care and assisted living is mandatory vaccination for all those working in those facilities as of October 12th, and that's what's being announced today. There are other measures that can be considered, and we're looking at all measures to protect people and adjusting what we're doing in keeping with the circumstances and keeping what we know. We have highly vaccinated, in the context of the world sense, a highly vaccinated population in BC, and that's great. We need those numbers to be higher, and they will be, and we're continuing to work to see that they will be. And if other measures are required, I know that consideration is made every day, not just in specific workplaces, but across the population. It is not mandatory for a citizen to be vaccinated in BC, but there are things that you may not be able to do if you're not vaccinated, and that's something that's, I think, obvious and something that we're reflecting on now. I'll hand it over to Dr. Henry.
Yeah, so when we think about public health orders, what we try and do is put in place orders that are proportional to risk and the type of risk that is being experienced. And so when we look at long-term care, we know that the vast majority of residents are immunized, and the majority of healthcare workers are immunized. And in many, many facilities, it is 100%. So this won't impact them. But in some facilities it isn't, and it can be quite a bit lower even than the average in some facilities around the province. And this really speaks to a level of risk that leads to severe illness and death. So that's important, and that's why we've put in orders, particularly around people working in these high-risk settings. Yes, we are looking at other high-risk settings, like other healthcare settings. The level of risk is different in an acute care setting versus the communal living setting, like long-term care. It's also fundamentally different in community settings. So if we look at schools, we don't see a high risk of severe illness. We don't see any deaths associated with schools. We see that schools are a safe place, for example. And we saw really good drop-off in cases when we had immunization of teachers and school staff, which we prioritized. So the level of action that we need to take to prevent severe illness illness and deaths is different in different settings. And yes, we are looking at that. As I mentioned, we're talking about schools, we're talking about some of the communal living settings and post-secondary institutions, but we've also been a focus on workplaces. And you may recall early on when we had vaccination, we targeted vaccine early to some of the high-risk workplace settings, the food processing settings, for example, the farms where people are living in communal settings. And immunization has made a tremendous difference in those settings, and we're not seeing transmission and outbreaks in those settings. So those are the places that we're working with industries to make sure that measures are in place, the communicable disease plans, the important pieces of the COVID safety plans that work to protect their workers, because that is important for business as well. And we see that in the central Okanagan, where unfortunately we had transmission amongst staff, and businesses can't operate with that many staff ill, and it meant that we had to put in some more reductions and restrictions in those areas. So yes, this is important for all of us across the board, but where we know the most impact is going to be is where we've put orders in proportional to that risk of severe illness and death, and right now that's a focus on long-term care.
Jawad Siddiqui, Omni.
Minister Dix. So there are some businesses in BC who are laying out this policy that they would only hire employees who are vaccinated, and some of the businesses I have spoken to have gone to the extent of saying their present employees that they would be fired if they don't get vaccinated. Is this something that you encourage?
Yeah. So, our role is to look at health. But yes, these are the things that businesses need to make decisions based on the risk of their business and the risk to their business. As we just talked about, in some areas, if you have people who are coming in who are non-immunized and who cause an outbreak in that business, that can be very severely impact the ability of the business to function. And we've seen that, as I mentioned, in places like some of the restaurants, et cetera, in the central Okanagan. So these are business decisions that they need to make in conjunction with their own labor lawyer advisors. But I do think it is a perfectly valid thing. We also need to look at, how do we ensure that places like the arts, if we're having high-risk settings, and we're talking through this, what does it mean to have a high-risk setting right now with 80% of our population immunized, and reducing the risk for those people, where a small proportion of people who might bring risk into those settings. So those are all discussions we're having.
Do you have a follow-up, Jawad?
Yeah, thank you. So just to understand it better, even if businesses are non-essential, they are well within their right to impose such a rule on their current employees to be vaccinated to be able to work there.
Absolutely. Absolutely. I think that is a business decision. And I've had discussions as well with other groups like faith leaders, and how to encourage only immunized people to attend services. Those are decisions that faith leaders, communities, church groups, choirs make for themselves, understanding their communal risk. They don't need an order for me to do that. Those are things that businesses, communities, groups can do together to collectively reduce their risk.
Next question is from Rob Monroe, Info News.
Thank you for this, Dr. Henry. I have been trying for quite some time to get vaccination rates for healthcare workers in general and in long-term care, and they haven't been able to provide them. You're bringing these measures in because of a need to get this vaccination done. Is there any data that you can provide of how many people, particularly in long-term care and acute care, that work there are vaccinated? And why can we not get that information?
So my understanding is that information has been provided from what we know. So what we know are general levels by health authority and by overall in the province. What we also know is that we don't have detailed information on every individual by facility, and that's what part of this order is. So this order will allow us to understand vaccination rates by facility for all workers and residents. And that is not information that we have right now because we don't have a requirement for people to report their immunization status to their employer in long-term care and assisted living. So the reason it's a provincial health officer order is so that it applies across the board to both private facilities, all licensed facilities essentially. So we will have that information, and as you say, it is important information for us to know in public health at a detailed level so that we understand risks by facility. So we do have aggregate information which we have shared, but we don't have that facility level information, and that's one of the things that we have been putting in place, the ability to collect that information. And over the next couple of weeks, we will have that by facility across the province.
Follow-up, Rob?
Yes, and with slightly different angles is there have been some children hospitalized in Interior Health. I believe one was an 11-day-old baby, and I think you made a comment another has been. Can you provide any more details of those hospitalizations, how serious they were, and leads to the question of where are we in terms of possibly vaccinating children under 12? Where's the science on that?
Sure. So, yes, I was asked the question about whether there were children in ICU in the interior, and the answer is no. And there are no children under the age of 10 or 12, hospitalized across the province right now. There had been, over the past month, there have been 2 children under the age of 12 who've been hospitalized in the Interior Health region, and that's the amount of information. We don't provide identifying information about individuals, but both of those children have been discharged home, which is good news. But yes, it is a concern, of course. We're following the data quite closely around what's happening around immunization for younger children under the age of 12. So both Pfizer and Moderna have been doing what we call dosing studies, and they've come up with their dosing schedule. So it will be a lower dose for children 6 to 12 years of age, and a lower dose for 6 months to 6 years of age. So those are the 2 sort of age groups that we're looking at for children. Both Pfizer and Moderna have done those dosing studies, and they're now near the partway through their phase 3 studies, which is looking at non-inferiority and safety compared to the adult immunization. So what we do, we don't need to repeat all of the major randomized controlled trials anymore. What we need to do is show that there is the same immune response in younger people that provides protection for adults. So that's the type of studies that are going on right now. We understand from Pfizer that they're likely to have the information for at least 6 years to 12 years of age, so school-age kids, probably by the end of September into October. And then the National Advisory Committee and Health Canada will review those data to provide approval for use or licensing for use in Canada. We expect that it'll be submitted to Health Canada at the same time as they're submitting to the FDA and the European regulatory agencies. That's one of the things that this pandemic has done, has made all of the regulatory agencies to work together and to share information. So it is a potential that we'll have at least one vaccine available for people younger than 12, maybe by the end of this calendar year. If we're lucky, maybe into November. So that's what we're following. The things that Moderna is a little bit farther behind. It looks like it probably won't be until the early in the new year in 2022. But things can change, so we'll be watching that as well. One of the good things that we're hearing from Pfizer is that they have a new formulation for their childhood vaccines for the under 12, and that they might be fridge stable, which would be really great because that makes it much more flexible in being able to provide immunization.
We have time for one more question today. Emily Warren, CBC.
Yes, good afternoon. Thank you for the presser. Dr. Henry, there has been a dramatic increase in cases in the Kootenays, similar to the situation in central Okanagan. And we're wondering, will similar restrictions be extended to, in the past 2 weeks, never mind. I got the wrong question. My apologies. In the past 2 weeks, you've been making targeted restrictions and announcements for high-risk settings. Why aren't you telling British Columbians that widespread changes, for example, reinstating the indoor mask mandate, may be required? Why is a stronger touch not required for all of BC right now, given that the rolling averages of cases outside the interior have been quadrupling in the past 2 weeks?
Yeah, so those are things that we've looked at, and when we put out the Step 3 plan, we understood that that we're in a different place when we have most people protected through immunization. So it means that we're decoupling the hospitalization and deaths particularly from the cases themselves. So we are looking at a more regional or local approach, and my colleagues across the province in public health have been doing this. We've been monitoring and so it depends on a whole bunch of things. So I worked very closely with Dr. Sue Pollock in Interior Health when we started to see the impacts in the central Okanagan, not just on people getting mildly ill and having to stay home, but impacts on businesses and spillover into healthcare workers becoming ill, into long-term care homes, and into the hospital, as we talked about earlier. So there are a number of different factors that we look at to determine whether we need to take additional measures to address focal transmission, and it was really took off quite rapidly, as you will recall, in the central Okanagan. So yes, they're watching very closely in the Kootenays, and there was a couple of other places around the province where we've seen spikes of cases, but they're often related to a single event that we are able to identify many of the contacts and isolate them before there's transmission, before there's spillover into other more vulnerable areas. So I know Interior Health is working very hard in the Kootenays to try and contain what's happening there. We're also seeing very different types of patterns in different parts of the province. So right now, and we talk every day with my public health colleagues, right now we feel we don't need to take additional measures across the board for sure, or in specific areas, but we will if we need to. And there's been a couple of outbreaks very recently in Fraser Health, in long-term care, and so additional measures have been taken there. We are looking at this, and these are the things that change as we're moving through this period of time. But I will reiterate again that most of these cases, whether they're in Fraser Health, whether they're in Vancouver, whether they're in the interior or the north, are spread by people who have not yet been immunized. And so that's what we can all do to support people to get the vaccines that will keep us all safe.
Emily, do you have a follow-up?
Yes, thank you so much, Dr. Henry, for your answer. And I was hoping for both of these answers if Minister Dix, if you could please as well get us an answer in French. But Dr. Henry, you did touch on this as well a bit earlier, that many sports and cultural event organizers are now considering asking for proof of vaccination for people to be able to attend them. How does this affect your views on mandatory vaccination for everyone? And if we could get that answer in French as well, that'd be great. Thanks.
So again, I think there is a really important ability for people to make that decision about their personal health. We know there's some people who are unable, though that's rare, have medical reasons not to be immunized, and we need to support them. But I also think we need to put it commensurate to risk. But we have said early on, and I still now that we have enough vaccine available, so we have been on an evolution from this. It's not fair to put in restrictions on people when they don't yet have access to vaccine. We're in a place now, since about the end of June, in the last month or so, where we have adequate supplies of vaccine, we have adequate availability, and really it's about people, and I hear from people and that we talk to that a lot of it is around convenience, but also around a bit of complacency. So we need to make the point to many people that now is the time to get immunized, because it is going to have an impact on your ability to do some of those things that you may want to do. And attending a sports game is a good example. Those are higher risk environments, indoors. Going to a concert indoors. If you choose not to be immunized, then you don't necessarily have the right to go into a higher risk environment with a bunch of people who have been immunized and are protected. So those are decisions that we need to make personally and as a group here, and those are the discussions we're having with industries and others across the province.
Je dirais en français, premièrement, pour la première question, que je pense que ce qu'on est en train de faire, c'est de prendre des actions précises pour répondre aux besoins précis des régions. Donc, la santé publique, dans la personne de Dr. Pollock, a pris l'action dans la région de Central Okanagan il y a quelques semaines. 2 actions, première étape et puis deuxième étape, pour répondre à une circonstance quand même extraordinaire de transmission dans cette région. Dans d'autres régions de la province, il y a la transmission, mais c'est lié souvent à un seul incident. Et donc, on pris des mesures appropriées dans chaque circonstance. Dans un contexte où la grande majorité des gens ont été vaccinés, il faut prendre des actions différentes et importantes. Sur la deuxième question, il y a bien entendu un choix de ne pas être vacciné, mais ce n'est pas un choix sans conséquences. Quand il y a, et ça, il se peut dans l'avenir, et on a parlé au Québec de ces questions aussi, des choses qui ne sont pas essentielles, mais qui sont des choses où la transmission est possible. Par exemple, peut-être un match de hockey, c'est pas un droit d'y assister. Mais il y a une responsabilité dans ces circonstances, peut-être, d'être vacciné. Et on est en train de discuter de ces questions parce que ce sont des questions qui ont des conséquences pour tout le monde. Et on va continuer ces discussions dans des jours et des semaines à suivre. Et pour plusieurs domaines, les domaines de l'éducation, par exemple, ces discussions sont en train depuis quelque temps et on va avoir plus à dire dans la semaine prochaine. Merci beaucoup. Thank you very much, and we'll see you next time.